Hello.
Hey.
Hi, Gina Beasley.
Yeah, that's me.
Hi, Gina. How are you? I am Camilo Villaver. I am the treating physiotherapy today. How are you feeling?
Um, yeah, not the best.
Not the best. I bet you are.
Mm,
All right, Gina. Just to double check and so for safety precautions, can I please get your full name, date of birth, age, just to know that I'm with the right patient, please?
yeah. Gina Bursley. 37 years old. My date of birth is 13th of July of 1987.
Good.
And yeah, that's me.
Yeah. What brings you here?
Hi. Well, like about 1 month ago, I woke up with like dizziness and like very awkward symptoms.
Mm-hmm.
Um, and I went to work. I'm a school teacher, by the way.
You're a school teacher. All right.
And yeah, I feel like so like on a boat,
All right.
sort of. And so I have to kind of like hold myself to do the class. It was very
Wow.
uncomfortable, and then I throw out a few
Oh,
times.
yeah.
So the principal of the school sent me home.
All
So I
right.
took an Uber because I wasn't able to drive. Even that morning, I leave my car at home.
Mm.
And since
Can I?
then,
Sorry, Gina. Sorry to interrupt you. I know
yep,
you are. You are telling me, but I know that you from the notes that I got here that the ENT sent me to me. Because he referred you, Dr. Chahud. Is that correct?
yes,
All
correct.
right. I know that you went to the emergency department there, and they referred you to the GP, and the GP start to see like a sort of fluid coming out of your ear.
Exactly.
Is
That's
that correct?
all that's coming after that.
All
Yeah.
right. And did the GP told you what was that, or the ENT told you what was that? Was a near infection? Was
Yes.
Did you had any antibiotics for that, or was?
I was doing that. Yeah.
Uh-huh. And how
Few
long did you
weeks.
took your antibiotics?
2 weeks.
2 weeks. And
7 days.
all
Sorry,
right.
7 days.
And can I know, please, when was that?
That would be 3 weeks ago now.
3 weeks ago.
Yeah.
Cool. Good stuff. And I know that the sorry, so 3 weeks ago, and you took that for 2 weeks. So you ended up your antibiotics 1 week ago. Is that correct?
Yeah, correct.
All right. So then the ENT sent you to physio because your symptoms were not improving at
Yeah.
all, and yeah, you're still with nausea, dizziness, and you know not feeling very well.
Yes.
All right. Before we can go ahead, may I please confirm with you, do you have any other medical condition? Sorry, I'm just
No.
gonna grab a chair.
No, I've been very good. Like before this, I was super active. I love to go to the gym. I like to dance. Like yeah, hiking. Like
All
stuff
right.
like that.
But
So
not other medical condition.
no, no, no. This
Not
is
at
what I'm
all?
saying. Like I'm always being very fit, and
Wow,
so this is
that's
like
great.
it's been changing a lot.
Beautiful. Are you taking any medications like in a regular basis?
No,
Not allergies at all?
no.
All right, so no meds, no allergies. Do you smoke?
No, I sometimes I vape,
All right.
but like it's rarely. Like every 2 weeks when I go out, like just like I don't have my own like, but
All right, so
sometimes
maybe.
like I ask for my friends because I kind of like I like it, but
All right.
I don't really.
All right, beautiful. And what about drinking? Do you drink alcohol?
No, no, no.
Not at all?
Mm-mm.
All right.
I used
Yep.
to.
You
I
used
used to
to.
when I was young,
All right.
but yeah, no.
As everyone of us
Yeah, but
probably.
yeah, like now I'm a school teacher, so like I have to prepare, so I
Yeah.
don't really have
Sure thing.
much time. But it feels like I'm hungover. To be honest, I
Yeah.
feel like so like
So juicy.
yeah,
Yeah, I can
yeah.
understand that. Um, yeah. How is your house set up? Do you live in a single-story house, in a double-story house? How is that
Yes,
like?
I live in a single-story house,
Yep.
so yeah, I don't have stairs, so it's not a problem.
No stairs for going in and out of the house.
No,
All right.
yeah, I live with my boyfriend, and yeah, he's
Does
been
he works?
yeah, he work, so like he been helping me a lot, but like he have to work, so I'm like trying to like
All right, all right.
deal
And
with my things.
I don't have any information of your hobbies. What would they be?
Oh, like I told you, so dance, gym, and hiking, like bicycle, like, like
Dance, gym, like doing like
yeah,
presses
power
and.
lifting,
All
yeah,
right.
like weightlifting.
Yeah. All right. So dance, gym, and hiking.
Yeah, sort of like a CrossFit. So.
Oh wow, CrossFit. I
Mm,
remember that I did CrossFit one time, and after the first session, I start to feel like pain where I never thought it was gonna be pain.
yeah, it is very hard, but
Yeah, I
like
know.
I miss it so much, but I
I
cannot
know.
do
It could
anything.
be. You're not being able to do pretty much anything.
Oh,
So that's gonna be my sort of next question. What were you able to do before this happened?
yeah, all like my hobbies, like no
You
problems.
were
Or
fully independent,
yeah, yeah,
not not any problem at all.
super fit.
Driving,
Yeah,
taking the bus, or riding
yeah,
your
no,
bikes and
everything.
stuff.
Yeah.
And how is this vertigo affecting you? I know that it sounds an obvious question or an obvious answer, but I just want to point out what are the things that are stopping you to do your regular stuff. You know?
Well, pretty much all my life now it's like it's been stopping by this.
Mm,
The none of my hobbies. I don't feel like able to do anything. Even like driving, I'm not driving
yeah,
because yeah, it's no. I'm out of school as well, so I'm doing nothing. I mean, I'm trying to be like in bed to like in case these things appear. I feel like not a risk if I'm because I'm gonna throw up or like
yeah. Oh no, I know what you mean. I know what you
yeah.
mean. Just to make sure, are you still working now or are you on leave?
No, I mean, yeah, annual leave.
In in leave.
I was supposed to be working in 4 weeks.
Supposed to start it 4 weeks ago, or you
I'm
are
supposed to
starting?
coming back to work in 4 weeks.
So you still have 4 weeks of,
Yeah, like
ahead.
that's maximum range that
All
I
right,
could like
all
stop
right.
because I already stopped. So I'm taking my holidays and everything like now. So
Yeah, sure
yeah.
thing. Sure thing. Shouldn't be easy. I know coping with these things, sort of things, but in that matter, how are you coping with this? Are you, finding yourself struggling to go through
Yeah,
your days?
a lot. This is what I can't wait to like feel better.
Mm.
I hope you can help me.
And do you think you have all your tools or all the resources available to go through this by yourself, or do you think maybe you are going to need some sort of emotional support, or you know,
Um,
because
well,
it has to be really really rough to go through
I
this
know.
being feeling like
I feel
disabled
like
and stuff.
so frustrated to be honest. It's been
Yeah,
very
I would be the
difficult.
same probably. Yeah.
So yeah, like I don't know, maybe
Because there is a
yeah.
lot of resources out there just to talk with somebody or get some sort of emotional support. If you don't mind me, we can make a good referral to.
No, that would be great.
Yeah, you
Yeah.
reckon? All right. So probably after the session we will do a referral for emotional support. Cool.
Like a psychologist.
Yeah, probably they are the specialists, so they will find out what is the right fit for you. But definitely we will find, and yeah, if you don't mind, or if you are not too sure what is this about, maybe next session I can come back to you with all the information that I could gather, and make a sort of a good referral, so you can also get that sort of support apart from the physical therapy that we are
Yeah, that sounds
gonna
great.
start today.
No, that sounds
All
great.
right.
Thank you.
Good, good stuff. Before we can go ahead to our hands-on assessment, I just want to make sure there is no red flags around your pathology, around your presentation. So, have you had any weakness or feel any weakness in one side of your body or something like that?
Not really.
Any chills, fever, cough?
Yeah, that was in the first time. Yeah, I was like feeling like one
Because
month ago.
I remember that you had a near infection, and that came with a sort of obviously
Yeah, it was
a
like
normal reaction of the
yeah,
body
like
to
cold,
fever and
flu.
stuff. Yeah,
Yeah.
but it ended up and hasn't happened again. Has not
No,
happened
no, no,
again.
no, no.
All right, good. Not night sweats,
No.
not history of any cancer or tumors or family with that sort of stuff.
No.
Not that you are aware of. All right.
No.
Have you had any problem with your bowel or bladder? bladder, bladder and bowel problems, like sort of incontinence or
Not at all.
problem with the, bowel movements and stuff?
No, not at
No?
all.
Good. From what I can see here, there is a low chance of a stroke. Plus, I know that the ENT already assessed you. You already went to the emergency department, and you already were assessed by your GP that knows you. Good.
Feel like ages.
I
I've been
know.
just jumping from
I know,
another.
jumping from one to another one. So
So frustrating.
it's so frustrating not being able to do your own stuff.
Do you think you can help me? Like, I mean,
Yeah, probably. But what you came with was a diagnosis of vestibular neuritis, which is something that just want to double check. I just want to make sure there is nothing else apart from that. First
yeah.
thing, and if it is vestibular neuritis, did the GP or the ENT told you about this? What is this? Why did this happen? Or
Yeah, he explained to me a little bit, like, so kind of like I understand. And I also have a friend who had something similar,
all right.
so she was like just feeling like a dizziness and like every time that she wake up. So she went to the physio, and physio did like a maneuver or whatever,
Oh, great.
and she was great after that. So I'm
Wow.
very excited, and I hope you can help me with
All
that.
right. Did your friend told you what was that? What was her diagnosis? You remember that?
Um, Not specific, but similar symptoms.
Mm-hmm.
She say when she start to move, like for me, it's like it's not like that. Maybe that's maybe it's a little bit different, but I guess it could be like similar.
Yeah. Well, probably the symptoms are really closely related. Um, there is one pathology called BPPV, which is something that it's peripheral in nature, and that basically is something that is malpositioned. There is a wrong position of one part of the inner ear, and that maneuver is helping to put back in place the thing that was misplaced. You know what I
Okay.
mean?
Yeah.
So that's called the BPPV, and that's why she could be better as soon as the piece that was not in the right position was repositioned.
We're
You know
gonna
what I
do
mean?
the same.
But in this case, this is different. This is a different pathology.
Yeah.
It's closely related to the inner ear, but the problem with vestibular neuritis is that there is an inflammation of the nerve itself that takes the information from your inner ear, meaning all the position of your head, your body in relation to the gravity, in relation to the space, and it's taking this information when it's working properly, it takes that information and brings it to
Oh,
the brain.
sorry, I'm feeling like a bit dizzy. Sorry.
Oh, all right. You need to wait a little bit.
Yeah. No.
What eases your distance?
Oh, I feel like it just like it's moving and like it's like pressure, like just like it's everything is
You don't hear any tinnitus, any sort of
no.
acute pitched sound.
I don't usually have issues with my ears. Like
Mm. Not
I
hearing problems as well.
that's good. Yeah.
All right. And usually last the distance. How long does it last?
A couple of minutes,
All
but
right.
it's coming just like sometimes. Oh,
Does it
sorry.
help if you take a deep breath, maybe?
Uh, Not sure.
And if you keep your eyes open, they are going to give you some other inputs to know where your head and your body is related to.
Yeah, like I just have like sometimes when it's too bright,
Now,
I can feel like it's very
we're
overwhelming.
going to try to lower the light of the light here,
Yeah,
just to make it a little bit more comfortable for you.
thank
Uh,
you.
yeah, hopefully that helps you.
All right, now
Oh,
I'm feeling better. Thank you.
cool.
Sorry.
That's great. No, that's all right. That's all right. Anytime that you need to stop a little bit and you feel dizzy, that's fine. We can
Yeah,
stop for a while, and
thank you.
yeah, we can do whatever it is. It's something that we can certainly do for you. I was talking about vestibular neuritis. So the inner ear is something that is within your ear, obviously, and that is telling our brain how is the body in relation to the space. So what happened is that this infection that you had a couple of weeks ago, uh, made some of inflammation of this nerve that takes, it's a sort of a wire that takes the information to the brain and tells the brain how are you, we moving, where are we at the moment
Okay.
in, in life, in real, in real life. So with this inflammation, this wire that is connecting the inner ear to the brain is not working properly. So
How we can reduce that inflammation?
well, there is a few ways to do it. Um, the physiotherapy is not something that is going to loosen or reduce your inflammation, but it's going to improve a little bit your symptoms, and it's going to improve a little bit your disability. You know what I mean? So trying to make the most while we let the body heals.
Okay.
All right.
Yeah.
I know that one of the treatments for vestibular neuritis is corticoid, a short-term corticoids, or a short, um, what do you call it? It's like a short course of corticoids, maybe a couple of days. I don't know. That's something that maybe your GP could give you a hand with that. I don't know, and it's gonna be one of my questions. Did you have a chat with your GP about corticoids specifically?
Well, yes, I was so frustrated last week, but he suggests like to go ahead with you first to see
Mm-hmm.
how I'm going, and if it's still like that after our treatment, I can like maybe go more invasive with the corticoids.
Yeah, sure thing.
But I
Well,
feel like just like so frustrated. So
I don't think it's a bad idea. This is my personal opinion. I don't think it's a bad idea to go ahead with to give it a shot with the corticoids.
yeah,
I think that is going to improve a little bit your symptoms. It's going to reduce the inflammation of the nerve itself, and that's gonna bring you back to your normal life. That's
okay,
one thing. And the second thing is doing your physio exercises
okay,
in order to be able to cope in a better way with all these symptoms.
yeah,
You
that
know what
sounds
I
good.
mean?
Yeah, sounds
So
good.
my plan could be something like give it a shot for 2 weeks and then see how it goes. And yeah, have a sort of a chat after 2 weeks to see if those symptoms improve and how are you feeling about them. And yeah, maybe then we can refer you back to the GP to take another consideration in the corticoids.
Yep,
Sounds good to you?
yeah.
All right, cool. Um, just to make sure, what are you expecting from today's session?
Oh, be able to do my stuff like a little bit more normal, just like because I feel like like a drunk. I cannot like hold myself, so I'm trying to like maybe improve a little bit of that,
Mm-hmm.
like symptoms.
Okay, okay. I can bring you with some strategies to cope with dizziness and vertigo. Um, but yeah, maybe being able to go back to your normal routine is something like a long term goal.
Yes.
Probably a short term goal would look like something like being more able to small things like stand up by myself or not feeling so dizzy after
Yes.
any movement and
Yeah, I agree. Yeah.
things like that. How does it sound to you?
Yeah. Good.
Cool.
Yeah.
All right. Now it's the second part of the session. We are going to do some hands-on assessment, and then we will be planning some exercises together.
Okay.
All right. So first thing that I want to do is just confirm the diagnosis of vestibular neuritis. I probably the GP already did the same with you.
Okay.
They rule out stroke, which is great. That's something that we can. That's gonna basically gonna fix itself. The vestibular neuritis. We just need to give the body the time, allowed time for healing.
Yep.
You know what I mean?
Yes.
All right. So I know that the GP probably or the ENT did the same, but we are going to do something that is called hints. And the hints is head impulse, nystagmus, and test of skew.
Okay.
All right. I know you have been having nystagmus, vertigo and dizziness for a long time now.
Yeah.
So that's probably uh, giving us the information that is something like more not peripheral. You
Okay.
know what I mean? So
Yep.
I just want to make sure there is nothing pointing us on the stroke side. All right?
Yep.
All right. So look my head. This is going to be, provocative test, but I just want to make sure you are relaxed and relaxed. I am looking for I'm looking for some saccade movement of your eyes, which is something like repositioning. And I can see some saccades from you, which is great. It's great. It's great to see the saccades of you. I'm seeing the saccades.
Oh my goodness, what is
Are you
this?
feeling dizzy?
Yes.
Yeah, cool. That's all right. All right. You did well. You did well. This is the first part. The second part, I'm just going to cover your eyes and see if it's doesn't shouldn't be any shouldn't go anywhere your eye. You shouldn't move your eye. So it's great. This is pointing us in the right direction. This is not a stroke. Your eyes are still straight, which is great.
Just looking for the pigeon on your roof.
Oh yeah, the pigeon. The pigeon is yeah. This is part of my clinic. You know what I mean. All right. Good. Second part was good, and yeah, the next part is assess for nystagmus. And yeah, we just need to make sure. Can you follow, please, my finger to
Yeah.
the right side, to the left side? Probably you don't have nystagmus, which is great. Beautiful. All right. Cool. No nystagmus at all. Hints test was orienting us to peripheric pathology. There is no test of skew, so I'm happy with the diagnosis, vestibular neuritis, which is great. I just want to make sure we have a baseline neurological assessment. And for that, I just want to know if you have experienced any swallowing problems, any problems speaking, any problems with your face or muscles of the face,
No.
arms, legs, nothing at all?
No.
All right. Can you please let me know when you see
No.
my fingers?
No. No.
Beautiful.
Just before. Like, I mean, no. No.
Good. Can you hear this
Yes.
for me?
Yes.
You hear well? Good. Good job, Nadia. Can you please put out of your mouth the tongue?
Uh,
Uh-huh.
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 And make a big smile for me. Beautiful. Can you please, how do you say when you make a frown? Make a frown for me.
Yeah.
Make a
Squint.
frown.
Squint my
No,
eyes.
frown. Make
Oh.
a good frown. Frown.
Squinty.
And try to pump a balloon. Beautiful. Doesn't seem to be any problem with your cranial nerves, which is great. I just want to make sure you can raise your arms. Good. Again. And now to the front. One more time. Beautiful. Now bend your elbows. One more time. Beautiful. Now push my hands. Push my hands. Beautiful. Twist your hand. One more time. One more time. Beautiful. The other one. Ah, you're so strong. What are you doing?
I told you.
Dumbbells? Are you doing
CrossFit.
dumbbells? Come on, you're shaking so hard, my hand. That's great. Can you please, yeah, you know what you need to do. All right, one more time, please. Beautiful. Don't let me push you down. 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 Cool. Close your eyes, please, and I'm going to touch your skin. Can you feel this?
Yes.
And does it feels the same?
Yes.
You feel the same? Here,
Yes.
here.
Yes.
Sorry, I'm just gonna put your arms there. Here,
Yeah.
here,
Yeah.
here, here,
Yeah.
here.
Mm-hmm.
No problems at all.
Nope.
In the back.
Nope.
No? Beautiful. Open your eyes. Cool. Can you please rise up your knee? Beautiful. The other one. All right. What about strengthen your leg? The other one. And pump your knees.
On my knees.
No, pump your ankle. Sorry. It's just that I confused the joint. I'm new with this. This is my first time here. All right. Now we're going to do the same. Push my hand. The other one. All right. Push my hand. Push my hand. Push my hand. Push my hand. And push my hand. Wow. So strong muscles. Beautiful. How are you feeling now?
Not bad.
Not too bad?
Yeah.
What about the head movements?
No, like the
Look at the left. Look at the right. That's your left. That's your right. Good. Just wanted to know if you are focused.
Yep.
Look at your right. Look at your left. Cool. Look at up, 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 down. Any symptoms with that?
Nope.
No? Cool. How are you feeling?
Not bad.
Not too bad? All right. Can you stand up for me, please? Cool. Deep breathe. There we got our patient. And with a nice rest today. Beautiful. How are you feeling? Are you feeling good, Jen?
Yes.
All right. Can you please step aside for me? Step to the other side. Mhm.
Yeah, that's tricky.
It's a bit tricky, you know. And I am expecting this to be like that.
Okay.
All right. One step in the front. One step to the front. One step to the front. All right. And to the back. Step front. Step forward. Step backward with the same feet. Step backward. Try to make it with the same feet. Sorry. So right goes forward. Right goes backward. All right. All right. Right goes forward. Right goes backward. All right. Now you're going to do the same but with your left foot. Good job. Left. Forward. Leg backward. Yeah, from what I can see, you need minimal assistance of one person or minimal assistance. You need to hold down on something.
Yeah, but I
Balance
don't
is.
feel safe.
I know. This is not something that we are used to. Like we don't used to be, losing the balance.
Yep.
So because you are 37, you are health, so that's fine. This is something that we are going to work on. I just want to make sure you put your feet apart, like 20 centimeters apart. Are you okay there?
Yep.
All right. Since your posture be in the middle line, which is great, there is no weight shifting, which is good. Your head is right. There is no abnormalities in your spine, which is good. Um, just want to make sure you can do weight shiftings there. Good. You're a bit scared
Yeah.
of moving. Yeah, 100%. Can you please stay there, stay in the midline, and close your eyes? And I'm gonna just.
Sorry.
That's all right. You don't need to sorry. This is something that I was expecting. So I'm just gonna make sure how much, how long can you hold that position. All right. It's gonna be like 5 seconds. Was do your best. Good. And you need to step forward. You didn't step backward, which is something that I'm going to take note of. Can you please do the same thing with your feet together and try to keep the midline there? Eyes open, sorry. Your eyes gonna be open. All right, there is a lot of AP swing. There is no much lateral swing. It's more like an AP swing, anterior-posterior swing. All right, I'm just gonna make sure we are assessing the time here, and that's over 20 seconds. But apart from the swing, there is nothing else. You didn't need to step backward or forward, which is good. Keep your feet together, please. All right, and now we're going to do the same with your eyes closed. All right, close your eyes. Feet
No, I
together.
sorry. Can.
That's okay. You can try because this is gonna be something that we are going to work on.
Okay.
So I just need to know what is your baseline. You know what I mean?
Yeah.
So try your best. If it's 1 second, that's fine. If it's 0 second, that's fine as well. This is our base, and
Okay.
this is something that we need to know, so you can be sure how are you coming here and how are you leaving the
Yeah.
clinic.
Okay.
All right. So
Yeah.
put your feet together. Feet together. I know you are trying to put your feet outward, but try to put your feet together like that, pointing straight forward, straight forward. Good. Hands to the side. Take a deep breath and close your eyes. Cool. All right. Fair enough. That was 3 seconds. All right. This is what our baseline looks like. Uh, can you please do some heel rises for me? One more time. One more time. And do some marching on your heels. Heel marching. Not too bad.
It's difficult.
I know, but you're doing so well. That's so good. I just want to make sure and assess how are you walking. So can you walk back and forth for me, please?
Yeah.
Are you able to do it by yourself at home?
Uh, yes, I do with like slow movements.
Slow movements. We can't see you. I'm just, yeah.
My fault.
You don't. You're not gonna fall. I just want to know what is your baseline. So what I mean by that is I need to know if there is any gait deviation. It's any gait deviation. There is no gait deviation. Just losing the balance. I can see that there is a good heel strike, there is a good mid-stand face, and there is a good toe off of your gait. So there is no need to work on your gait, but definitely we need to work on your balance and your proprioception. All right? Can you have a seat, please? I just want to do one more test, and we will be all right. I need you to tell me, please, if your finger is up or down. I need you to keep your eyes closed, please. All right? Up or down?
Up. Up. Down. Up. Up.
Beautiful. The other hand.
Up. Up. Down. Out. Down.
Cool. I'm going to do the same with your finger, your toe, sorry.
Down.
Close your eyes, don't cheat on me, please.
Okay, sorry. Up. Down. 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 Up.
Cool. And the other leg, please. I don't know how much time are we doing here.
Down. Down. Up. Up. Down.
Beautiful. All right. And last one, some coordination. I need you to do this as fast as you can. Wow. That's so good. Other hand, please.
Like this?
Yeah.
I'm not very able with my left, but it's not difficult.
It's not too bad. There's a slight difference in the left between the left and the right side, which is something that happens to all of us. It's not significant. So it's not like a big difference.
Okay.
All right. The last one, we're going to do something that is called heel shin test, just to see your coordination. I need you to sort of a scrub or, put your heels toward all your shins. All right. Can you do it with your other leg, please? Right. All right. All right, Gina. Well, you have done really well today. From what I can see, and according to my assessment, all your symptoms are in accordance, are in line with vestibular neuritis. And what does it mean? There is no weakness, which is good. There is no range of motion alteration. There is no gait abnormalities, which is great. But there is some proprioceptive impairments, and there is some balance issues.
Okay.
All right. Do you understand what I am talking?
Yes. Yes.
All right. You know what proprioception is. You know what.
Yeah, I'm very familiar with those
All
terms.
right. Beautiful. That's great then. So my plan is gonna be something like working the whole time in exercises towards um, making you able to regain this proprioceptive input from your feet, your joints, muscles, spine, that is in, in line or communicating with your brain to tell the brain where the body is, in which position is it, so we are able to keep that position, during the gait or doing our functional activities.
Okay.
Sounds good to you?
Sounds
So
good.
for that, we will start walking probably, and in some exercises that are going to put you in uh, loss of balance. You know what I mean?
Yeah. For
All
how
right.
long we're gonna be working together?
Today's session, or are you
No,
are
like
you are you
our
asking me how
treatment.
long is gonna be the treatment so you
Yeah.
can get better?
How
Well,
how will be our
um,
plan?
the plan is gonna look like working session by session.
How
Um,
often?
Probably would be one, no, 2 times a week. That's
Okay.
something that I want to do with you at the beginning.
Yep.
I want to see you 2 times a week. It's gonna be, let's put an example. Today's Monday. I want to see you again on Thursday,
Yep.
and you're going to have Friday, Saturday, and Sunday to work on the exercises, and come back to me on Monday, and see how it goes.
Okay.
All right. All right. In terms of how long it's gonna take to get back to your previous level of function, as any inflammation of the body, you know that any person, all the persons are different. You know what I mean? So your healing could be faster than person B.
Yeah.
So we don't know that, and because this is my first session with you, I don't know how your body is going to react or is going to behave after the exercises.
Okay.
All right, keeping that in mind, usually vestibular neuritis lasts for a couple of weeks, probably, I don't know, 6 weeks or so,
Yeah.
and then the symptoms should decrease a little bit. You should have less vertigo, less dizziness. You
Yeah.
you are going to start
I've been
feeling,
feeling better about yeah. I'm
yeah,
still
feeling like
not.
a
I'm still not 100%.
I know, and that's something that we are going to work on. But after these 6 weeks or so, should decrease all the symptoms, and yeah, it will depend on people to people, you
Okay.
know, person to person.
Yep.
All right. So the first thing that we are going to do is working towards balance. All right. So I just brought here our unstable surface. Stay there. Cool. So we got our bosu here, or unstable surface, and I just want to you to step on that with your both feet. With both feet, please.
That's scary.
I know. It is gonna be scary. You're
Okay.
gonna feel like you're going to lose your balance. If you need to step backward or forward, that's fine. That's something that we are working on.
Yep.
All right. And I just want to, and I just want you to keep the balance there.
All right.
All right. Keep your midline. All right.
I
Can you?
always see these things in the gym, but I never use it.
Wow. These are so good for balance and proprioception. All right. I'm gonna be so close to you, so you're not gonna fall. Be reassured on that. All right.
Yep.
All right. But what I'm gonna do is make some perturbation, what we call a
Oh.
perturbation, and I need you that this happened to you, and I'm happy with that this happening to you, because this is something that we need to work on.
Okay. Okay.
All right.
Yeah.
I'm going to start to pushing you in a random, in a random. All right. Cool.
Yeah.
Beautiful. Much better. Good. Good. Let's get to the parallel bar now. Come to the parallel bar. You're here in the parallel bar. A little bit backward. Cool, okay. We're in the parallel bar. I want you to do not hold to the parallel bar. Walk as if you were at home and try to do like what we call like a tandem walking. And that means put one step in front of the other in line with the other.
Oh goodness.
All right? My goodness, it's gonna be so
Really?
hard. Yeah,
Can
100%.
I hold it?
No, I mean, you can if you lose your balance, but
Okay.
you're not meant to hold on the balance.
Okay,
I just
okay.
want you to lose your balance and try to regain the balance.
Oh.
Yeah, it's so hard. Good. It's gonna be exhausting this. And if you need to have some rest, just let me know, right?
Now it feels better.
All right. Next feet, next feet, sorry, the left one forward.
Woohoo.
Cool.
I used to do when I was at the school.
Really?
I used to do gymnastic.
What were you doing? Ah, in the like it was what is it called? Parallel,
No, it's
whatever.
like yeah,
Yeah,
that's
it's a
whatever.
parallel whatever. Beautiful. That was a really good sport.
Yeah.
I know
I used to
you have
practice it.
really good memories of that.
I love to practice it parallel whatever.
Yeah, the parallel whatever are always good. All right, and now we're going to do the same but going backwards. Wow,
Okay.
like a Michael Jackson thing.
Okay. Dun, dun,
I want
dun,
you
dun,
to
dun.
start being like feeling like a good Michael Jackson
Oh
there.
goodness. It's difficult.
Yeah, it is.
I used to be so good
You
at
didn't
school.
come here to do some
I used to jump.
beautiful exercises and easy exercises. You come to the physio, you came to the physio looking for challenges.
Exactly.
Yeah.
Okay.
All right, go ahead. Cool. And backward. I'm not going to ask you to do these exercises with the eye closed
Okay.
so far because we're just working the balance here. You know, I don't want to take one more of your senses away.
Yep.
But probably when you are doing better with these exercises, you will be able to start working with eyes closed. Okay?
Okay.
All right. Now that we're in the parallel bar, put yourself in the parallel bar, hold to the parallel bar. I will make sure there is a chair behind you. If you want to have a seat, that's fine. If you
Yep.
feel this seat, let me know. We can stop as well, and at any time that you need. Put your feet together. Your hands is gonna slightly touch the parallel bar,
Okay.
slightly touch, just so you are sure where are they,
Yep.
and close your eyes there. All right. Try to release and try to keep that posture. Head in front. Don't cheat. Don't cheat. All right. Head in front. Good. And what I want you to focus on is try to feel your feet. Try to feel the position of your hips in the space. Focus on that.
Yep.
Focus on what are my feet are. What information are my feet giving to me, to my brain. Right? Because we need to start working on that rather than the ear one.
Okay.
All right?
Yep.
Sounds good to you?
Great.
Right. You're doing so good. So good. You're not dizzy?
Nope.
No? That's so good. All right. Good. Good. How are these exercises sounding to you? How does
They
they
are
look?
very challenging,
They are challenging.
but yeah, I guess it's because we have to go through this.
All right. Fair enough. This is something new. Um,
What is that?
this is a unstable surface. Could be a mat or whatever. That's gonna take away the sense of your plant. Salt. Sorry. We're going to be here just 1 minute or 2 minutes. I just want to show you
2
this
feet,
clear.
right?
No, 2 feet first. Just take 2 feet and stay there. Cool. You look good.
Yeah, thank you.
All right, can you do the same but with just one feet?
Oh,
Oh, this is a challenge now. I know.
oh no, it's so difficult.
So difficult.
Let me try with the other one.
Mm-hmm.
Yeah, I'm better with my right.
All right. Yeah, I know. The left side is a little bit less stable, but that's fine. All of us has a different, a better, a side that is more strong, that is stronger than the other one. So we have difference left and right. All of
Okay.
us have. All right. All right. Go back to the plinth or chair or whatever you are sitting on. Go back there. Sorry, no, go back there. Sorry, was my mistake. I just want to reassess all the things that we have assessed first. So it's gonna be the same thing. Fits together. How long can you stay there? Wow, that's a really good improvement. You can be there like for an hour or so. You should recommend this physio, alright? Alright, now fits closed. Sorry, fits closed, fits together, and now eyes closed. Oh, come on. Can you see that you're doing much better?
Yeah, for
You're
sure.
doing 10 seconds instead of 5,
Wow.
which is good, good. What about gait? Can you walk there for me, please? Go, walk. Walk for me, please. Good. I can see that you're doing much better. You're doing a Michael Jackson now. Great. How are you feeling now? This is something subjective, so how are you feeling now?
Feeling good.
Feeling better?
Yeah.
I bet you are. Are you gonna recommend me?
No,
Not yet?
because you push
Fair
me.
enough. Fair enough.
You push
Go
me
back.
to walk.
Go back
It's
to your
not very
chair.
professional.
All right, fair enough. Just want to make sure, Gina, that that my that our exercises are doing well, and I just want to make sure you are doing them at home. All right, this is going to be like an exercise program.
Okay.
So first thing that we're going to do is put a pillow under in the floor, and just want to make sure there is a chair behind you, and you have two chairs around you. So and probably your boyfriend is in front of you.
Yeah, okay.
All right. So do that like I don't know, 5 minutes, 6 minutes. That's fine.
Yeah.
Then between two chairs, you're going to do the tandem walking.
Yeah.
Chair, holding onto the chairs. Just slightly touch and put your feet in front, then feet behind.
Yeah.
Feet in front, feet behind. All right, feet in front, then the left, feet behind.
Okay.
Feet in front, feet behind. And the same as you are going to do standing there. You're going to try to put your feet together and close your eyes.
Okay.
All right. Each position should be held for about 5 minutes. If the dizziness came and you feel dizzy or you feel nausea or whatever, have a seat, get some rest, wait for the symptoms to be relieved, and then start again. All right.
Yeah.
And do this about 3 times a day.
Okay.
All right.
Yeah.
Do you have any question for me now?
Not really. Everything's
Not really.
very clear.
Cool.
When I see you again on Thursday,
On
right?
Thursday. Sure,
Beautiful.
for sure.
Yeah. How many
See
times
you.
a day? Sorry.
Oh,
Forgot to ask.
3 times a day.
Twice. Yeah. Sorry.
Yeah. Good.
Thank
See you
you.
next time.